My topic was Alzheimer's disease, and I'm going to talk about my case study first. My case study is about a lady named Shirley Self, and her husband first started that she was becoming more forgetful, but he just assumed it was because of aging. Well, around 10 years after she had started to forget more easily, she had also forgotten how to drive to places she was familiar with. So they took her to the doctor, and in 2008, it was confirmed that she had Alzheimer's disease. Shirley is now 64. She rarely speaks, but she can still be delighted when she sees someone she's familiar with. I'm going to talk about what Alzheimer's actually is, the symptoms, effects of Alzheimer's, and treatments, and just making the disease more manageable, and then how Alzheimer's also affects the family. Yeah.
Taylor, will you put like the next two lights, or at least the first one? Okay. That's good then.
Alzheimer's is a form of dementia, and that's just when brain cells become damaged. The brain cells are called the diseased neurons, and they affect an important neurotransmitter. And the specific neurotransmitter is called the acetylcholine, and it's essential to memory, so that's why memory loss is common, and it's a lot more common as you get older. Some symptoms, they can occur up to 10 years before a person is actually diagnosed. And the problem with trying to decide if you actually have Alzheimer's is there's no way to really tell unless that person passes away and you can have a brain autopsy and look at the brain tissue. But some symptoms are memory loss, repetitiveness, you say the same thing over and over again, behavior changes, irritability, you might try to pick fights with another person, and you're not able to speak fluently, you may just not be able to find the right word to say. And that's just shows how like an advanced Alzheimer's brain, it like just deteriorates, like it just gets really small and just disintegrates really. Yeah, sorry.
That's okay. That's fine.
Effects of Alzheimer's, brain shrinkage, loss of nerve cells, and that's just again about the acetylcholine being damaged. Memory loss, ability to do simple tasks decrease, like even just eating and going to the bathroom, you like will forget how to do that. You lose the ability to speak clearly, and your body weakens, which increases a person's risk of getting a harmful disease, specifically pneumonia. And actually, a lot of people with Alzheimer's, they pass away because of infections that they get. Oh yeah, that's just like showing kind of just the brain activity of like a normal brain, and then just the Alzheimer's, not a lot of the brain is working because it just can't anymore. Okay, yeah. I think there might be one more thing to click, but that's it. Yeah. Treatments and medicines. There's not a cure for Alzheimer's right now, but fortunately medicines have been discovered that they can use to slow down the effects of Alzheimer's. There's also simple things people can do to help the patient. The medicines that they use to help with Alzheimer's is called psychotropic meds. They alter emotions, and they can reduce anxiety and behavior problems. It might also help to just have a change in setting for the person with Alzheimer's. It doesn't even have to be going to a nursing home. It could just be simply just getting out anywhere and counseling. It helps the person with Alzheimer's to spend time with their loved ones because it may make them feel more comfortable, because they most likely they'll remember their loved ones the most. It also helps to find simple tasks for the person to do. A person with Alzheimer's, you don't want them to feel useless, and a lot of the times that can happen to them. And so just finding any small tasks can help. The problem with Alzheimer's is it also affects the family dealing with the disease. they have to realize that their person that they love is sick and there's not really any cure for them. You also have to realize that they're going to pretty much forget everything they've ever done. They're not going to be able to say what they ate for lunch or where they went to school when they were younger. It's a really traumatic disease, or it's a really traumatic experience for the family members, but fortunately there are things to make this disease go better. It's good to actually know what the disease is and what it's actually doing to their loved one. You can contact the Alzheimer's Association, this is their logo, and you can join a local support group. You also need to understand that every case of Alzheimer's is different, no one's the same. And helping out the actual caregiver of the person with the disease is good because it's really stressful for them, and it may get to the point where they just cannot simply provide for that person. The person with Alzheimer's is going to have to go to a nursing home. Okay, so the reason I chose this topic is because the year 2010, my grandma was diagnosed with Alzheimer's. I didn't really think much of it at the time because I didn't know what it was, and it wasn't as bad. My grandma she was always really smart. She was vice principal at the high school, and she taught English. I noticed when it first started taking its toll when she stopped doing her crossword puzzles because she couldn't really write clearly and read. She used to always just say funny jokes, and she doesn't really do that now. By 2012, she couldn't read books at all, and she spoke even less. And I realized what the disease was doing, and I really didn't like it. It was bad. Around two more years have passed now, and Alzheimer's is really rough for my grandma. She doesn't speak full sentences, and she likes to sleep a lot. She can't bathe herself, and she also can't tell when she needs to go to the bathroom. My dad always says she's physically there, but not mentally. And it's true because she'll be there, but she won't know what you're saying to her. Also about the caregiver being stressed, it's affected my grandpa a lot too, and he just joined a support group. And he's more like a father to her than a husband now, and that's really been a struggle for him. So I think you have to actually experience the disease to know how bad it really is, or know someone with it. And now I'm going to show a video.
Yeah, I actually had Emma's grandma. She was my freshman English teacher.
Really?
She was hysterical. Mrs. Keller. Did you work with her? She's really funny. She was one of my favorite English teachers. She's very laid back. Her class was fun.
Yes.
So who did you like English? Why do you
So
like
I like it. I have really good English teachers, and I really thought I would do Spanish, but I like it.
You can do both.
And this video was created by the Alzheimer's Association.
Is it always like that?
Well, not. Sometimes they're quieter. She's like introducing, I think, the novel. Do you guys notice so much? Sometimes.